Hi, this is Dr. Thomas Lin. I'm a UCLA graduate from the School of Medicine since 1995. I've been doing primary care for a number of years, with recent years being more concentrating in the field of aesthetic medicine. And this is a very exciting field for both patients and myself because we're getting some very incredible and satisfying results. So today I'd like to talk to you guys about the aesthetics treatment plan, which is very shortly coined as ATP. So this is something that patients already come to my office wanting a plan of action. So we devise a plan to achieve that goal. So this is very commonly I get asked, "Make me beautiful, doc," and this is something that the patients ask me, and we will try to formulate a plan of action according to the patient's wishes and budget. So like ATP, which is a cellular energy packets that makes cell function and directs its function, the same thing in aesthetics. I like to think of the aesthetics treatment plan as that ATP which drives and fuels as well as directs the aesthetic goals and functions as well. So my job as an aesthetics physician is to formulate such ATP according to the patient's wishes and their budget, and to achieve a very satisfying aesthetic outcome. For example, some patients may want a lip enhancement. For instance, younger patients want their lips to be defined and enhanced. So we'll devise a ATP according to their wishes. These same younger generation millennials would like acne therapy, for instance. So we devise a ATP to take care of their acne pimples of their face using lasers and prescription medications. And then of course there are some neurotoxins that can be also used in the same millennial population patients who want to prevent the formation of wrinkles. The older population may want an ATP to soften their already developed wrinkles on their face because they would like to obviously be younger looking, and so the ATP may be involving neurotoxins, PRP, and some lasers, may even PDO threading to define and volumize their deficits in their face. Women would like sometimes, most of them would like an ATP involving painless hair removal because they don't want facial hair or underarm hair or pubic hair excessively. So we'll devise an ATP for that painless hair removal. Men and women with some baldness, central hair loss, for instance, for women, and in the back of the head and in receding hairline, hair loss in men would desire the hair restoration, and the ATP will involve using PRP, which is platelet-rich plasma, for restoration of hair in men and women. And these are using prescription medications as well as some lasers and PRP. PRP, just so that we'll define it as platelet-rich plasma, can be enriched from the patient's own blood for facial rejuvenation, making patients look younger, and also can be used for scar remodeling for these scars that are developed from acne's long-term or even burns from the past. Some patients would like an ATP involving just more suppleness to their face and more youthful look of volume, so that can be used in focused ultrasound or radio frequency, that devices that can increase collagen production in their face and therefore achieve more younger looking face. So other patients comes to me wanting a tattoo removal, so I would devise an ATP for their tattoo ink regret to remove some of these things. And then Q-switch lasers, a very advanced laser, is used to remove ink with all colors of ink and in all skin types. Many ATP plans involve inducing micro injuries underneath the skin, and this is so that production of their own collagen can be thereby following. But this micro injury will like to be followed up in my clinic, Anew Laser MD, with the exclusive use of hyperbaric oxygen medicine. And this is something to increase healing in their face after micro injuries has been induced with these lasers or ultrasound or radio frequency or even PRP. So this is very good for increasing circulation and increasing tissue regeneration. So in a nutshell, you bring me your wish list of what you would like, your goals and your desires, and with my expertise as well as advanced equipment, I devise a ATP, an aesthetic treatment plan, to fit your wishes and budget. So consultation is always free at Anew Laser MD. So wouldn't you like to know your own ATP to reach your goals? Thank you.